बहिणाबाईंची जात्यावरची ओवी म्हणजे
May I now request our esteemed panelists, Dr. Pradeep Mahajan, Dr. Chandrasekhar Azad Singh, and Dr. Rahil Shah, Director of NM Medical, to join us on stage. Welcome, doctors. Let us now begin today's panel discussion on the sickle cell disease and the Endari sickle cell disease medicine developed by Dr. Yutaka Nihara and his team of Taas Live Sciences Inc. USA. First question goes to you, Dr. Nihara. Why is sickle cell disease so prevalent in India, and why do you think it has been ignored for so long?
Sickle cell disease actually have been known for hundreds of years. This is one of the diseases that we discovered with its morphology about 100 years ago in Chicago by one of the dental students, actually. And then in 1940s, we knew this disease for the first time of any diseases we knew at the molecular level. 1949, this happened in California at Caltech. In other words, we've known this disease for a long time, and we knew how severely this affects a patient. And I cannot really explain why. We've done a lot of research, but nothing was really leading to helping the patients. I think one of the reasons why this work to do something for sickle cell patients got delayed was there was really no real activist for this disease like some of the other diseases. Once we put our mind to it, it wasn't very long before we discovered a target that we can treat. It took us only about 3 years going from scratch to proof of concept, and the proof of concept was recognized by National Institutes of Health. By 7 years, we were recognized by FDA, but no pharmaceutical companies wants to take this on because they thought there was no money in it. Now it's changing a little bit. So then what we had to do was we had to raise money from family and friends and start our own company. That's how the process started and how I got involved in this business part.
Sickle cell is a disease that is largely disguised because of lack of diagnosis. माननीय मंत्री महोदय से यही हमारा अनुरोध है कि इसके लिए एक टेस्टिंग का प्रोग्राम बनाया जाए जिससे कि खास तौर से अनुसूचित जाति जनजाति के लोगों से और जो लोग बीपीएल में हैं जिनके मेडिकल टेस्टिंग नहीं हो रही है उनकी ये टेस्टिंग हो पाए तो उस टेस्टिंग से ही ये पता चल पाएगा कि असल में कितना प्रभाव है इसका आज भारतवर्ष में.
Absolutely.
Actually, इतना बड़ा सब्जेक्ट है ये विदाउट एनी गवर्नमेंट सब्जेक्ट सपोर्ट वी कैन नॉट मूव. तो इस पे गवर्नमेंट सब्जेक्ट जरूर होना चाहिए क्योंकि ये देश का ऐसा एक सेक्टर का बीमारी है जिस सेक्टर ऑलरेडी डाउन टू डेन पीपल. इस सेक्टर को सेफगार्ड करने के लिए अगर कमीशन बनाया तो इनको की डिजीज से भी सेफगार्ड करने के लिए हम लोग हमारा तरफ से ज़रूर माननीय प्रधानमंत्री जी से राष्ट्रपति से हम लोग लिखेंगे और इसको आगे बढ़ाने के लिए कैसे हम लोग हमारा देश में इसका रिसर्च वर्क, इनका अवेयरनेस प्रोग्राम और इनका टेस्टिंग का कार्यक्रम हम लोग चला सकते हैं. जरूर ये विषय लेकर हम लोग आगे जाएंगे.
I would like to add this question little elaborate answer. I being practicing in regenerative medicine, particularly based on cell-based technologies, and I have been working on this science for last more than 10 years. The diagnostic part, what sir mentioned here, in a country like India has to be a one which is most affordable because the lab-based technologies or molecular-based technologies are little expensive. So what I have proposed to the government, to the ministry, is that there is a blood drop test which could be done at the spot and which would be costing only a few hundred rupees. That's like, I mean, just to add to the thing where we can extend the program in a larger scale in the states where it is prevailing more so, or you can take Orissa, Maharashtra, Gujarat, or even the eastern part of the states where we have a lot of prevalence of cases. We have done a lot of epidemiology study on this, And we have come to the conclusion state-wise percentages where the disease part as well as the part which we can call as an, you can say sickle cell triads. We can work upon that. Probably, sir, Minister, sir, you can put in a highlight on this and we can take it to the larger scale in the national way. Thank you.
Absolutely.
Just
Thank
to
you.
address your question, we are working on a rapid test which can be administered without medical supervision to self-diagnose, especially for children, so that families can do that. And it is a very low-cost test, which would be tailor-made for the market in conjunction and would be manufactured in India. One of the things that I wanted to mention is that Endari is not only looking to bring their medicine to India, they want to make a plant in India. They want to manufacture it in India. They want to be a part of the fabric of India. ये सारे डॉक्टरों को जो कि रेयर डिजीज़ को देखते हैं, उनको सबको साथ में लेके और इस रोग और अन्य रेयर डिजीज़ रोगों को आगे बढ़ाया जाएगा, उस पर रिसर्च करी जाएगी. जैसे डॉक्टर ने अपने उसमें कहा कि ये एक अंत नहीं है, ये दवा एक अंत नहीं है, दवा एक शुरुआत है. तो इस शुरुआत के आगे भी काम चलेगा. आज भी इनके यहाँ काम चल रहा है इसी पे. तो रिसर्च में कोई कमी नहीं हुई है, बस ये है कि अब लोकल मार्केट में भी रिसर्च होनी है.
Shah, what is your opinion on this whole conversation that we've been having so far?
But I do work in the healthcare space, and we run a chain of diagnostic and health checkup centers. I think what I can weigh in here is the fact that the country as a whole needs to adopt prevention in a larger manner and preventive screening in a larger manner. Unfortunately, if you look at across the country, except for a few examples in large cities like Bombay, Delhi, Bangalore, in the rest of the country, most of the healthcare is reactive in nature and really is diagnostic and not preventive or predictive in any way. That's a bit of a shame because today India has a capability with the plethora of high-quality healthcare diagnostics available in this country, including a fairly decent number of genetic testing labs to be able to sequence, very, very efficiently at reasonable costs. One would hope that, in the next 5 or 10 years, the biggest change that will come in the way we practice healthcare is the adoption of preventive healthcare and predictive healthcare. And there are a few labs that offer predisposition to various diseases with genetic testing, but they need to evolve a little bit further with targeted programs for well-known conditions like sickle cell disease, where for specific types of population, one can get funding from government health programs and really push at a preventive level rather than waiting for the disease to manifest.
Yeah, as you said, there are already government programs. So the question is to target and focus on these kind of diseases. So we must collaboratively work with government and industry, as well as with employers, insurance companies, reinsurers, to make sure that there's a collaborative effort, because if the testing is robust, then this can be controlled. And if the testing is robust, then certainly parents can be told prior that you have a much higher risk if you two are getting married of having sickle cell in the next generation.
Absolutely. That's so true. So Dr. Nihara, will Endari be affordable in India? Because you have heard what people have been saying, so please explain to us.
Yes, I want to make sure that it's affordable. In the US, for patients, they hardly have to pay anything because government and private insurance covers. For India, I'm going to leave it to our bankers to make sure that it can be distributed to all the patients if possible.
We are fully committed to make sure that Endari is affordable, not just for the middle class, but also for BPL and Antodaya. And we will ensure that is the whole point of local production.
इसमें पहले हम लोगों को इसको बिलीव एस्टेब्लिश करना पड़ेगा. लोगों को अभी मन में शंका होता है जो बाहर से कंपनी आ गया क्या है इसमें. तो पहले हमको इसको अवेयरनेस एस्टेब्लिश, बिजनेस मॉडल वो ऑटोमेटिकली आ जाएगा. बिजनेस मॉडल का बाद में सोचेंगे. लास्ट पहले तो स्टार्टिंग करो किसी एरिया पकड़ के, आपको कोई पूरा देश में एक बार में चेकअप करने का ज़रूरी नहीं है। एक जिसमें रेशियो रिसर्च वर्क करके जिधर में रेशियो ज़्यादा है तो उसी एक एरिया में पकड़ के आप लोग उसको हाईलाइट करके फोकस में लेके उसी एरिया में आपको एस्टेब्लिश करो जिस दवा कैसे फ़ायदा हो सकता है, ये एस्टेब्लिश करें। फोकस में जब आ जाएगा ऑटोमेटिकली आपका पास बिजनेस मॉडल खड़ा हो जाए, आपको सोचने का भी जरूरत नहीं है। तो पहले आपको ये एस्टेब्लिश करना पड़ेगा।
Absolutely. Dr. Chandrasekhar, now that we've learned about Endari and its efficacy, what are your thoughts?
Yeah, my thought is clear. What I have personally seen is that in India, most of the tribal people and most of the lower socio-economic strata suffer from this disease. These people cannot even afford for the blood test or the treatment which is already available, hydroxyurea and other treatment which were available. It was not available to these people because of the cost factor. So yeah, definitely this is very important thing that Indari should be economical, and if some government or local body can help them, and if they can incorporate this into the national program or something like that, which can subsidize the whole thing to, and which so that it is easily available to the people who are affected exactly. So what we have seen that in the tribal areas of Gujarat, Maharashtra, Odisha and in the Madhya Pradesh, lots of people are suffering, and means if you go at the ground level and see, people are literally dying of this disease, and they have 1 or 2 hemoglobin, and plus these people have means going for the delivery and other things. Means patients are dying, and you can also see the younger population dying because of this disease. And since it has been neglected by the government bodies also since long time, so it's a need of an hour. I think it should be, I mean, something has to be done in this field because lots and lots of people are suffering from this disease. So I think some national program has also to be incorporated. मंत्री महोदय से मैं ये करूँगा कि आप आगे इसकी गुजारिश करिए कि ताकि नेशनल प्रोग्राम में इसको इनकॉर्पोरेट किया जाए ताकि जो गरीब जनता है उन तक ये पहुँच सके।
तो मैं अभी इसलिए बोले कोई एक छोटा जगह से पकड़ के आप लोग स्टार्टिंग करो, इसके प्रूफ एस्टैब्लिश करो, इसके फ़ायदा क्या है। अभी तो सबको मन में एक डाउट हो जाएगा ना कि क्या आ रहा है, क्या बिजनेस करने वाला है, किस मॉड्यूल है, तो इसको पहले एस्टैब्लिश करो जिसपे क्या है।
जी बिल्कुल सही बात है आपकी माननीय मंत्री महोदय, और आपको हमने जैसे आपने बोला है तो उसके लिए जो पायलट प्रोग्राम की दवा रहेगी वो हम फ्री में देने को तैयार।
हाँ ठीक, तो ये एक एरिया पकड़ के एक दो एरिया, एक 2-3 स्टेट भी एक साथ में हम शुरू कर सकते हैं।
बिल्कुल।
Now I want to ask you guys, because we've learned so much, if you have any questions to the panelists.
Dr. Pradeep Mahajan, if there is no medicine available right now at the moment, how is the treatment being given to the patients?
In fact, there was a time in 1972s, it was a Society of Sickle Cell Disease was formed in US. I believe that as time when hydroxyurea came in the picture. Earlier, there were no challenges. People used to die with the mercy of people looking at them. Recently, after hydroxyurea, there are many molecules have come which may have change in genetic expressions to some extent, modifying the gene and making the disease more milder. But to the extent when it is a disease, the quality of the disease is very high level. In that cases, probably we have only choice of bone marrow transplant or otherwise. They reduce the crisis by using the modalities which have come into existence, and third, the genetic additions which will be coming in the future.
Talking about Endari, what made you think of introducing Endari into Indian market?
Basically the simplicity of it. Most of medical treatments require some form of refrigeration or some form of temperature control. This is quite difficult when you're trying to go into rural areas.
And I like to make sure to add that at this point of all the data put together, Endari is the most effective treatment available for sickle cell disease.
So Dr. Nihara, what is the roadmap of the introduction of this medicine in India? After how long will it be available?
Well, I would like to bring it tomorrow, but I think it's up to people of India and government, and anything that we can do, I'm willing to commit myself to bring the treatment so that more patients can be able to carry on better life. And also maybe we can work with them to find even a better therapy going into the future.
Thank you so much. Thank you. Heartfelt gratitude to all the panelists. And now we will move on to the next section. May I request Mr. Haldar to felicitate? We will begin the felicitation program now with Dr. Yutaka Nihara, please. Mr. Rahil Shah. Dr. Rajesh Dere. Dr. Pradeep Mahajan.
डॉक्टर प्रदीप महाजन हे प्रसिद्ध यूरोसर्जन आणि स्टेम सेल रिसर्चर म्हणून ओळखले जातात. सध्या ते चेअरमन आणि मॅनेजिंग डायरेक्टर आहेत स्टीमरेक्स बायोसायन्स सोल्युशन प्रायव्हेट लिमिटेडचे.
Dr. Chandrasekhar Azad Singh. Dr. Neeraj Jha. Dr. Rashi.
डॉक्टर राशी अग्रवाल या एक प्रसिद्ध हॉस्पिटल नियोजन आणि व्यवस्थापन सल्लागार आहेत. वॉशिंग्टन युनिव्हर्सिटी USA मधून पदव्युत्तर शिक्षण घेतल्यानंतर आरोग्य व्यवस्थापन क्षेत्रातील विविध पदव्युत्तर शिक्षण त्यांनी घेतलंय. देशात 3 आउटलेटसह IV विटॅमिन लॉन्च उभारण्यात आणि लवकरच मोठ्या सेलिब्रिटी आणि HNI रुग्णांसाठी आणखी 8 विटॅमिन लॉन्च उभारण्यात अग्रेसर असलेल्या त्या एक सौंदर्यविषयक व्यावसायिक देखील आहेत.
A big round of applause for Dr. Rashi. Dr. Swapnil Pandey. Put your hands together, ladies and gentlemen, for Dr. Pandey. Dr. Ranganath Chhavar to please join us on stage. Dr. Dattatreya Shivaji Chaudhary.
डॉक्टर दत्तात्रय शिवाजी चौधरी हे सुमारे 12 वर्षांपासून रिद्धी सिद्धी हॉस्पिटल आणि श्री गणेश क्लिनिकमध्ये 10 वर्षांपासून कार्यरत आहेत आणि 2 वर्षांपासून स्वतःचे 25 बेड्सचे हॉस्पिटल देखील सुरू केले आहे.
थँक्यू मिस्टर हलदर.
खूप प्रमाणात सध्या आजार वाढू लागलेले आहेत आणि त्याच्या दुप्पट गतीने डॉक्टर्स हे नवनवीन औषधांचा शोध लावत आहेत. त्याचप्रमाणे नवनवीन रिसर्चेस हे समोर आणतात. रोगांचं लवकर निदान होणं आणि योग्य ट्रीटमेंट रुग्णाला मिळणं हे डॉक्टर्स करतायत आणि त्याचमुळे डॉक्टर्स यांचं काम हे वाखाणलं गेलंच पाहिजे आणि त्यांचा हा सन्मान म्हणजेच मानवतेचा सन्मान असं आपण समजूयात. त्याचबरोबर हेल्थ आयकॉनचे पॅनलिस्ट डॉक्टर युताका निहारा, डॉक्टर राहिल शहा, डॉक्टर प्रदीप महाजन आणि डॉक्टर चंद्रशेखर सिंग या सर्वांचे मी मनापासून आभार व्यक्त करते. त्याचबरोबर प्रमुख पाहुणे युनियन अँड स्टेट मिनिस्टर NCSC व्हाईस चेअरपर्सन श्री अरुण हलदरजी, तसंच या कार्यक्रमाची उत्तमरित्या धुरा सांभाळणाऱ्या डॉक्टर अदिती गोवित्रीकर यांचेही मी विशेष आभार व्यक्त करते. सोबतच सर्व मान्यवर आणि उपस्थितांचे खूप खूप आभार.